Hi, I'm Dr. Kelly, and today we're going to be talking about one of the most asked for treatments in aesthetics, and that's lip filler. Have you been wanting to do your lips, but you're worried about unnatural results, migration, or being overfilled? Well, today's podcast is for you. I think it really has to do with technique, and also less is more for lips. Lips can go from looking beautiful and natural to being overfilled really quick. Better to start low and slow and build more and add more filler later on if you want a bigger lip in the future. So migration happens a lot of times due to technique. Some people use the cannula, which some people do say that leads to more migration than using individual needles. But a lot of times migration happens if you put too much filler in too quick. You can easily correct migration. Usually you have to dissolve the full lip though, which is unfortunate, especially if you just got your lips done and it migrates pretty quickly, then you usually have to start from square one again. But using little bits of filler each time and putting them in correctly and precisely decreases the risk of migration. You can tell you have migration by seeing filler where it wasn't put in. For the lips, it's usually above the pink or below the pink, and then it looks more puffy during this natural skin, not puffiness in the lips. Whenever you want. Whenever you look at the mirror and you think that your lips need a little boost or plumping, whenever you're ready, we're ready. How to find a good injector? Ask your friends, look on Instagram, come in for a consultation and see which injector vibes well with you. Everyone's preference is personal, and some people specialize in bigger, fuller lips. Other people specialize in more natural, subtle lips. So whatever you're looking for, that's who you should look for an injector. Yeah, so a lip filler consultation is always a good recommendation before just going to get your lips done. That way your injector can explain their technique, make sure it's a technique you're comfortable with. You can always research things on Instagram or TikTok, and different techniques equal different results. So you can always ask the injector you're going to at the consultation if they practice that type of technique. And then ideally talk about how many syringes. If you want a mini lip, it's usually only half a syringe. If you want more of a full lip, then sometimes you increase to 1 or even 2 syringes based on what you're looking for. Yeah, every filler has pros and cons. I like to use Reviness Kiss because I find it's very soft, easy to manipulate, makes the lips look very natural and beautiful. But every injector has a preference of what filler they like to use, and all have pros and cons. Yeah, it really shouldn't affect eating or drinking. Botox and filler both help with the smile. If you're doing Botox on the same day as filler, Botox obviously takes about 2 weeks to find full effects. Filler, you might be sore after first getting the lips injected, so you might not want to go eat a bunch of meals right after you get injected, but it's up to personal preference. So post-procedure, when you do any filler, especially lips, you do get some swelling. So when you leave the clinic, you might think, whoa, my lips are too big, but they do decrease significantly, about 10 to 15% due to swelling. So over the next week, all the swelling and bruising will go away, but that's pretty much the only downfall right away. Afterwards, just don't do too much. I mean, if you're gonna be a bit sore, but you can do whatever you want. I would say don't squish and manipulate your lips a lot. If you touch it too much, there's a chance the lip filler can move a bit until it kind of settles. So generally we say don't rub the area too much right after you get the filler. Follow-up schedule up to you and your injector. Some people like to do about a 1 or 2 week post filler follow-up just to make sure the results are what they want. Once your swelling goes down and you see what the lips look like, sometimes people want a little bit more, so you can always add more. That's the one problem with filler. If you go too much, you have to dissolve to start over, versus if you do a little bit, after a couple weeks, you can always add a little bit more if you want a bigger volume. Oh, that's a tricky one. It's up to you. Some injectors ask people to wait a year, even 2 years to get repeat filler. However, if you get filler and you realize that they're not the results you want, you can always add a little bit more as a top up. The dissolving rate of filler varies per person. Some people, it only lasts a few years, a few months. Some people it lasts 10 to 15 years. So we don't really know until we start doing the filler, and then follow up when you notice the volume has decreased again. Thank you for joining me today. Lip filler can be a confidence boosting and subtle treatment if you want it. It can be natural or as unnatural as you like it. Remember, beauty is what you think and beauty is what you want.